Thank you, Jan, and thank you, Per, Adam, and the rest of the organizing committee. I will talk about the epidemiology of hip and groin injuries in football. As you all know, these injuries, I will just call them groin injuries from now on to save words. They are frequently reported by footballers, and they often constitute a diagnostic challenge for the medical practitioner. There are numerous general injury surveillance studies out there reporting the number and percentage of groin injuries, but these data are rarely presented in the title or abstract of the article, just in the body of the article. So we therefore reviewed the current literature, summarizing the findings on epidemiology of groin injury in men's and women's senior football. We made a structured, traditional, or narrative literature search, not a systematic one. We used a broad literature search in PubMed and Google Scholar, and we excluded studies published before 1980. Duplications, of course, studies only involving one club, and youth and indoor football, including futsal. We selected 37 studies. We divided them into 5 groups: injury surveillance in men's football, in women's football, during tournaments, specific groin injury surveillance, and retrospective questionnaire studies. This is a busy slide, but this is the prospective cohort studies in men's football. We found 13 studies. Most of them were from Europe. 2 of them were from Asia, 1 from Qatar, 1 from Japan. Most of them involved the highest playing level in the country. And most of them studied only 1 season, but there are several studies that have followed their teams for many consecutive seasons. All of these studies, they defined injury according to a similar time loss injury definition, except one, the Japanese study, that used a cutoff of 1 week. And in this summary, we excluded that study and just took the 12 studies with a similar injury definition into account. And we can see that the injury frequency of groin injury was between 9 and 18% of all injuries in these studies. If we look at the second group, women's football, we were able to identify 10 studies. 6 of them were from Sweden, 2 from Germany, 2 from Norway. And what's growing on in Denmark, Per? No research? As for men's football, most of them involved the highest playing level, but all studies were conducted only on 1 season, no consecutive seasons here. And we can see all of them time loss, as I said, and the injury frequency was between 2 and 14% in those studies. If we look at the third group, injury surveillance during international tournaments, we have 3 studies here on men's football from World Cup 2002, 6 and 10. They use both a medical attention injury definition and an expected time loss injury definition. There are also 2 other studies, one from the Olympic Games 2004 in Athens and one from the European Championship in Portugal and England, that directly have compared men's and women's football. And as you can see, the corresponding figures here are 5 and 11% among males and 0 and 2% among females. The vast majority of those studies, they have used a time loss injury definition, but we know that many of the groin injuries, they are the result of overuse, so they lead to pain and perhaps reduced performance, but perhaps not layoff from football. So those figures are underestimating the true problem. These figures, they do not take player exposure into account either. But nevertheless, it seems, based on the reviewed literature, that groin injuries appears to be less of a problem in women's football compared with men's football. It might also be of interest to compare the tournaments from the standard club season injury surveillance. We can see that the proportion of groin injury is lower in the tournaments compared with the regular seasons. And one possible explanation to this finding is that players with current groin complaints in the end of a club season, they might not be selected by the national coach to participate in the tournament. Another interesting thing is that the relative amount of time loss injuries during tournaments were higher than during the club season. And this probably reflects that there are more acute injuries during a tournament compared to the regular season, where many groin injuries are associated with overuse and perhaps do not lead to layoff and the so-called tip of the iceberg phenomenon. If we look at the fourth group, the specific groin injury surveillance studies, we were able to identify only 4 studies, all of them conducted on men's football. 2 of them involved the highest playing level, 2 of them 1 season, and 2 of them at least 1 season. 3 of them used a standard time loss injury definition, and 1 study used a combined definition of medical attention and time loss. And as you can see, the figures here, 8 to 40%, are in line with those figures from the general injury surveillance studies, not having groin injury as the main objective of their studies. But there are no groin injury rates reported in the general injury surveillance studies. Here we can see that the injury rate expressed as injuries per 1,000 hours of exposure is 0.4 to 1.1 injuries per 1,000 hours. And the highest injury rate was found in the study Jan mentioned earlier, the UEFA Champions League study or the UEFA Elite Club injury study. And we can also see, and this is the same as for injuries in general, the groin injury rate is much higher during match play than during training. And if we look at the study from our group, published by Werner et al., 2009 in the BJSM, we can see what has happened over time. In this material, from the first 7 seasons of the UEFA study, there is no apparent trend of either increasing or decreasing injury rate. Not if you look at the injury frequency and not if you look at the injury rate per 1,000 hours. What about the diagnosis or the entities? In that study, adductor-related injury constituted almost 2/3 of all groin injuries. And as you can see at that time, FAI and the rest of the hip joint pathology was quite uncommon. Finally, we look at the 5th group. It's the retrospective questionnaire studies. There is one Finnish study on elite football in Finland, where they found a prevalence twice as high in males compared with females. And there is also a recent study from Sweden, where they looked at the prevalence of having a history of current or a previous groin pain. And this was 3 times higher among male players than in female players. So, to summarize, this review shows that groin injuries are a substantial problem in today's football. It's about the same magnitude as thigh, knee, and ankle injuries, and those 4 are the big 4 in today's football medicine. And groin injury seems to be more frequent among male football players than female football players, and with the limitation I mentioned before, this seems to be true regardless of the study design, setting, and playing level. And the literature suggests that the risk increase is about 2 to 3 times higher in males than in females, So you could consider groin injury in men's football as equivalent to the ACL injury in women's football, perhaps. So, in conclusion, some directions for the future. Yeah, we need, surprise, more research in this field. We need more studies reporting the injury rates for groin injury in football, especially in women's football, where we were not able to find any study at all. We need to see more studies out there directly comparing men's and women's football. Since we know that many groin injuries do not lead to time loss, we need to have more studies investigating the injuries not leading to layoff from football. We also need to see more data on the specific diagnosis or clinical entities. Have they changed over time? And we couldn't see any change in the trend during the 7-season period, but we need to have more longer follow-ups and more studies on the time trends in injury rates. And we would like to see more studies outside Europe, for instance, here from Qatar, but maybe from the US and Australia as well. So this is the Football Research Group from Sweden, headed by Jan Ekstrand, and also Martin Hägglund here, that you will listen to later this day. Thank you very much.